Recently, the American Heart Association released a presidential advisory with a stark warning. They said healthcare affordability in America has reached a crisis point. We're spending nearly $5 trillion a year on healthcare, and the AHA projects the healthcare costs related to cardiovascular disease will quadruple by 2050. Now, at the same time, a recent survey found that more than half of American voters say health insurance is their number one health concern, with healthcare affordability being one of the defining challenges of our time. People are skipping medications, they're delaying doctor visits, and they are facing increasing medical debt along the way. And here's what makes this even harder to accept. The majority of these costs are driven by chronic diseases, things like diabetes, hypertension, high cholesterol, and obesity. These are conditions that typically don't announce themselves with a single emergency. They often show up quietly over years, and then they accumulate without care between doctor visits. Now, what the AHA is calling for is more prevention, fewer financial barriers, and smarter investments in high-value care, and I couldn't agree more. In my pharmacy practice, I've seen firsthand what's possible when people get the right support, a dedicated care team, personalized coaching, medication guidance, and tools that are grounded in evidence and built around real, lasting behavior change. Not just a quick fix, a sustainable one. That's exactly the work we do at Omada Health every day, meeting people where they are with programs that are clinically rigorous and built for the long term. So this way, when someone with diabetes finally gets their A1C under control, it's not because of a hospital visit, but it's because they had consistent, accessible, human-centered support. That's prevention working, that's cost avoidance, and that's a better life. Virtual chronic condition management, when it's done with clinical rigor and real accountability, is exactly the kind of strategic investment the AHA is calling for. We shouldn't have to choose between affordability and quality care. The solution is already here. It's time to scale it.